Hey, hello everyone. Long time no talk. I just wanted to make a video because there's been a lot of updates since my last one. I think since my last video, hopefully it's published now, but since then I've gotten the wires in the back changed to thicker ones. And I think that was basically it until a couple of days ago when I finally got my first surgery. So when I say surgery, it's just a very small operation and nothing crazy. Like I wasn't put under. And so the reason why it's been taking so long, and actually this is one of my pet peeves as well, this whole process has been taking forever, and I feel like it's really because of the hospital. So I originally had to make the reservation like 2 months in advance to have these screws in my bottom jaw installed, and then I also have a separate appointment to do the top. And so the top part is done with the oral surgeon. So because Japan is just always like this, I had to have a consultation. First I had to reserve a consultation with the oral surgeon, and this is a university hospital, so everything is contained in the same hospital, but like each floor is something different. So for example, like there's the, orthodontic floor, and then there's like the oral surgery floor, and then the gum disease floor, etc. But because they're all different doctors, you have to make these separate appointments. And so I had to make a reservation for a consultation with this oral surgeon, which I don't even know why, because I've talked to him before, but they were just like, this is the procedure and you have to go through it according to the books, right? So I had to make another consultation appointment with him. And then after I met with him, and like it was basically the same as the first introductory appointment that I had with him, which was also part of the procedure. You have to have an introductory, like a shogajo, which is like an introduction letter to or like a referral letter to the dentist. So like everything that we talked about during that consultation was basically the same as the introductory appointment that I had with him. And he was even kind of like, so I guess that's it, right? Yeah. So he is the one who's going to be in charge of installing the screws in my upper gum, but the orthodontic department is the one who is in charge of doing the bottom jaw. And I'm not entirely sure why. Like maybe the top one is more intrusive. But anyway, so I had to also make the appointment for the bottom screws to be installed, because even though it's done by the orthodontic department, there's a specific orthodontist, or I guess orthodontic surgeon, who's in charge of that one, who is somewhat different from the oral surgeon. And I was kind of curious why I didn't have to make an appointment for a consultation with this oral surgeon, because, or maybe I guess he's not technically an oral surgeon, but I just thought it was strange how I needed to have a consultation with the oral surgeon doing the top part, but not the one who was doing the bottom. And so that was one thing. And I wasn't able to get an appointment until I think May. It was supposed to be during Golden Week in Japan. And also I also want to iterate that I planned everything around this. So because it was so close to Golden Week, I decided not to travel anywhere, because I figured I would have Golden Week to have this downtime and recovery period. So I thought it worked out well. That's what I thought. Not until they told me very last minute, like 2 weeks before, that suddenly that surgeon had to cancel because suddenly it was inconvenient for him. And I'm like, what about my convenience? Hello? So that was pushed back to this Tuesday. So what day is that? I don't even know. Sorry. I had surgery on May 13th, on Tuesday. And let's just say it was probably one of my top worst experiences, maybe. I'm not sure, because like I've had my wisdom teeth removed before. I've had 4 teeth extracted when I went through my first round of orthodontics, but let me tell you why this was such a bad experience, okay? So first of all, I know that I have an irrational fear, or I've developed an irrational fear of the dentist. And I know it's irrational, okay? And I think it's more so in the beginning. And then after it starts, I kind of calm down. which is funny because like I'm generally quite a calm, mellow person, and I don't think they were expecting me to have this fear. So I come into the hospital 15 minutes early. They call me in right away. Not right away, but like pretty early, considering usually they call me like 30 minutes late. So on time this time. And they bring me into the orthodontist in charge of my case. She brought me to the 4th floor, put me in the waiting room, and then I went into the room, which, by the way, this hospital looks so outdated. Just a very old building. Anyway, so it doesn't even look like a fancy surgery room or anything. It's just like a normal dental room, I guess. And they put me in the chair, put the thing on my arm so that they could see my heart rate and stuff. And I think it was really just this weird situation where like I'm in the chair, there's a professor, there's a student, there's my orthodontist, and they're all just talking while I'm in the chair laughing. And it also, the student actually was the one who put in the anesthetic, and the professor was telling him how to do it. So I was in the chair with my mouth open. He was showing the student how to do it and everything. And so that went smooth, thankfully. And the professor just, hovered over me. He was like showing the student like everything that he was going to be doing, like the different angles and how he was going to be making the incision, because this is not a normal implementation of the mini screws, aka TADs. So I think overseas or even in Japan, commonly it's a small procedure because they're just putting these screws into your gums and your jaws. But the way my teeth are laid out on the bottom, it's a little bit more complicated, and so that's why they had to actually make an incision. So they had to cut a flap of my gum, open that flap, and then put the screw at an angle because the space between my teeth was so narrow. And they had to then put the flap back over and sew it. So usually I think it's more common not to have the incision weight, so there's no like actual cut and then sewing involved. But because there was incision, I think it was like way more painful than it normally would have been. And so he was showing the student like where he was going to make the cut and everything. Yeah, so he cut it, and like I was completely numb here, so you can't feel any pain, but you feel the sensation, right? That part wasn't that bad. It was the actual screwing of the screw, which was really painful. And it's crazy because it's just a tiny, tiny screw like this. Yet the amount of pressure was wild. Like it felt like he was really like using all his force to screw the screw into my jaw. And it was so bad that I felt like my lower jaw was gonna fall off. It wasn't so much that the procedure was like super painful or what. I mean, I'll get to that. But anyways, so yeah, that was that. And then he had to put the flap back over, and then he had the student put the stitch in. After that was done, and like I was just sitting in the chair, my orthodontist took over and told me to go to the waiting room. And also she didn't really tell me anything about aftercare procedures. I feel like most orthodontic clinics are really good about telling you about aftercare. Like they should give you a paper, especially after surgery, There should be a paper with instructions on what to do and maybe an emergency number. But there was none of that, and she's always in a rush. So I was trying to think in the moment, like of questions to ask her, but I was also just, coming down from that adrenaline from surgery. And so I couldn't think of like all the questions I wanted to ask her. And then she just sent me back in, right? So they did give me a prescription for painkillers and also an antibiotic. So I have these antibiotics here, and then these painkillers, which are just aspirin. And so I took the painkiller right away. And actually the kicker is that the painkiller was the first painful thing, or the most painful thing, because after like when the anesthetic slowly started wearing off, it wasn't even painful. That it was for some reason swallowing these painkillers, which was so fucking painful. Like kind of like a sharp stinging pain down here. By the way, I would show you, but like I'm kind of scared, and like it's really far back, but they cut my gum way back here and then put a little screw in. And as you can see, I'm quite swollen on the side right now. And also, so the first time I took the pill, there was that sharp pain, right? And then I got home, I was starving, by the way, because I think I was just too anxious and I didn't properly eat lunch before surgery, so I was starving. And I was very optimistic since I wasn't in much pain. I was like, well, I'm gonna make some chicken udon instead of just something like purely liquid-based. So I had some ground chicken, udon, put some vegetables in there. I was very ambitious, and that took me like 2 or 3 hours to eat very slowly, I think. And then when I took the antibiotic, right? Like when I swallow pills, I usually have like a full glass, right? And then I'll tilt my head back, and I think I kind of do this like thing, right? With my mouth, because you have all the liquid in it. And I think that put pressure on the surgery site. And I actually felt a little pop and then really intense pain. So that freaked me out, and I actually ended up like getting a pack of ice and icing it. And I want to mention, sorry, I forgot, but immediately after the surgery, another dental assistant actually showed me the screw. So I saw it for myself, and I knew where it was because she showed me in the mirror, right? But ever since then, after coming home, cooking dinner, eating, I didn't check the surgery site because number one, like, it's fresh and raw. I don't want to be touching that or looking at it. And in order to look at it as well, I need to pull my lips back, right? Like my mouth back like this. So I don't want to, risk infection. So after I took the antibiotic and then I felt that intense pain and the popping noise, I freaked out, looked in the mirror, and then I couldn't see the screw anymore. So I know that there's a chance that these pads screws fall out, and actually it's quite common when I was doing my research on Reddit, etc. And also the hospital told me in the case that they fall out, they would perform the operation again at no cost. So because they told me that, I know it's a possibility. So I was just so freaked out, worried that I either, number one, accidentally swallowed the mini screw and didn't notice, or number two, it fell out and I didn't notice. Because why is it that I could see the screw after surgery and now I can't? And I know you might be thinking, well, isn't it just like your gums are inflamed, or maybe like they got really puffy and now it's kind of covering the mini screw? And yes, I thought that might be the case, but I took a flashlight and I looked really closely and I couldn't see any signs of the screw, which really freaked me out. And it was like 11 p.m. at night and I didn't have any emergency number. And also I started bleeding really badly. So that was another concern, right? Because I just swallowed this pill. There was a popping noise / sensation, intense pain, and a whole shitload of blood. So I was like frantically asking ChatGPT all these things and stuff. And I'm just so exhausted at the end of the day. So I thankfully managed to sleep. And then the next day, I called my ortho in the morning and she told me to touch the area. And like, okay, I know this might sound stupid, but the previous night I didn't want to touch the area because it was just freshly cut and sewed up, right? Like I don't want to touch this fresh wound. But she told me to touch it and see if it felt like there was anything there, like a screw. So I did, and actually it did feel like there was something in it. So based on that, she told me that it's possible that the actual screw itself is still installed, but the wire that was attached to it fell out. And it could be that what I saw immediately after the surgery was the wire and not the screw itself. So I don't know if that makes sense, but like the actual screw is embedded deeper in my jaw, and then there is a little wire attached to it so they know where it is, right? She was saying it's possible that it was the wire that came out, but I have to go back next week anyways on Tuesday to get the stitches removed, so they'll check it out then. But yeah, anyway, sorry this was really long. I just wanted to give a quick update. So that looks like right now when I smile. And I don't know if it shows up on camera, but when I look to the right hand side, I feel like it's quite swollen. compared to this side. And the pain is not that bad now. It's been 2 days, right? I think 2 days, yeah. It only hurts a lot over here, like my jaw itself. I think from having so much pressure put on it during surgery. Like if I touch it here, it feels very tender, just very bruised. And also it's a little bit difficult to open my mouth wide and chew. So I've been chewing on my right side and avoiding chewing on the left side. And also, before I forget, they only did the left side in this Japan, so they only do one side at a time. This means I have to go through this whole process again for my right side. So I am just absolutely dreading that. But also, I'm actually kind of glad at the same time. Like one part of me wishes that they just did both at the same time to get it over with. But another part of me is glad that they do it one at a time because it was pretty brutal.